So one of the things with the increased volume in a lot of athletes' training programs in CrossFit is that we start to see more tendonitis over the last couple of years than we ever had previously. And we're seeing it in the shoulders and elbows, a lot of pull-ups, a lot of hanging, right? And from a gymnastics background, you've dealt with this stuff many times, but how can we use Compex to allow them to train, but also kind of maybe relieve some of the pain that they're having through this tendonitis?
Well, first of all, I'd like to give you an unbelievable compliment, because I see that how the way you work and you develop the work with your athletes, you try to train them to school before you get them to the weights. So that's really a very good first step forwards. Tendonitis means that there is somewhere an overactivity, not enough recovery. So once we have the tendonitis, we have to take away the weight. That's the first thing. And that Compex come in, because I can still recruit muscle fibers. Taking off the weight, using electrostimulation, using the stimulation of the motor nerve to increase muscle fiber work. And you can still keep training even if you have a tendonitis. Well, the second answer I can give you is that we know that in the rehabilitation, eccentric work is a very important part in the treatment of a tendonitis. So a lot of tendinopathies are, let's say, treated by eccentric contractions. And that is where Compex comes in very well. I'll give you a very good example. If I give you a tendonitis and we take the other arm, if you have a tendonitis on this side, what we do, we use the Compex, you have contraction, and you at the same time, you do the contrary movement. So you create an eccentric contraction, which is in the treatment today a very important factor. And you can do it without load, with unbelievable effect.
So that was kind of my next question. If you have an athlete with a knee or ankle injury and they can't put load on it because maybe they're repairing meniscus or something, we can still create good active stimulation through the use of the Compex. We can create some eccentric loading on it without actually bearing down on the joint.
Exactly, and when you go to rehab, in some cases, I'm not able to do functional work. I'm not able to extension and flexion, and then I can do it in static.
Right.
And still in static, we have a trainings effect. And if we don't look for a trainings effect, we create the protection of the loss of muscle fibers. That means we don't have atrophy.
Right.
And we win 6 to 8 weeks.
Yeah, and it keeps our athletes moving even when they think they're laid up.
And healthy.
Yeah, that's amazing. That's great. So if we are using Compex to kind of deal with some tendinopathies, and we have an athlete who's maybe feeling a lot of pain in their elbow after doing a lot of muscle ups or rope climbs or something like that, how would they use that? What kinds of settings would they use to address the pain without creating a larger issue there?
Yes, indeed. Well, there are two factors who are very important, that if it's really a problem, go and see a doctor and a physiotherapist.
Sure.
The Compex is made for healthy athletes. And of course, if you have little pains, we can help you to work out. And in this case, the setting I would use is the active recovery. So take away the tension of the muscle and make the muscle relaxed. So that takes away the stress from the tendon. And then if you want to do a little eccentric workout, like I explained before, you can use the setting resistance. So you can take the resistance program, you go to an intensity where you feel that your hand is going into, we call it extension, and then you're going to work against it, and that gives the eccentric work. So directly after the training, your active recovery, to create a treatment, you use the resistance program, and maybe to prevent, before your training, you can do the warming up program.
Right.
So we made a warm-up program to give the muscle and also the surrounding of the tendon that what it needs, circulation.